हेलो फ्रेंड्स, आज हम स्टार्ट कर रहे हैं अपना ब्लड सप्लाई ऑफ ब्रेन पार्ट 1। सो पार्ट 1 ऑफ ब्लड सप्लाई में हम लोग डिस्कस करेंगे बेसिकली ब्लड वेरियस सिस्टम ऑफ द विच सप्लाइज द ब्रेन। इन पार्ट 2 वी विल डिस्कस द क्लिनिकल एंड रेडियोलॉजिकल इम्प्लीकेशन ऑफ ब्लड सप्लाई ऑफ ब्रेन। ब्लड सप्लाई ऑफ ब्रेन हमने पार्टली जब हमने अप्रोच टू हेमीपैरेसिस और स्ट्रोक पढ़ा था तब भी डिस्कस किया था। आज हम डिटेल में डिस्कस करेंगे। So blood supply of the brain basically have two type of circulation: anterior circulation and the posterior circulation. Anterior circulation comprises of the carotid system, in which two internal carotid artery forms the anterior carotid system. Right internal carotid artery and the left internal carotid artery form the anterior circulation of the brain and the carotid system of the brain. Posterior circulation of brain arises from the two vertebral artery, and this is called as the vertebro-basilar arterial system. So blood supply of brain 80% coming from the anterior circulation, which is carotid system, two internal carotid artery, and posterior circulation from the vertebro-basilar system, which comprises mainly from the two vertebral artery. So first is the vertebral system. So if this is heart, this is the left ventricle, left atrium, right atrium and the right ventricle. So aorta arises from the left ventricle. This is the aorta, this is the arch of aorta. From arch of aorta first arises the on right side right brachiocephalic trunk. Right brachiocephalic trunk. Right brachiocephalic trunk divided into right subclavian artery and right common carotid artery. So from the arch of aorta right brachiocephalic trunk arises, which divided and form the right subclavian artery and the right common carotid artery. Then in left side left common carotid artery arises separately and left subclavian artery arises separately directly from the aorta. So this is the brachiocephalic trunk, subclavian artery, right common carotid artery, left common carotid artery and the left subclavian artery. From first part of right subclavian artery there are arise of the left vertebral artery from the left subclavian artery. So left vertebral arises from the left subclavian artery and right vertebral artery arises from the right subclavian artery. This is the right vertebral artery. So right vertebral artery and the left vertebral artery are the branch of subclavian artery, first part of the subclavian artery. Right and left vertebral artery goes up around the cervical spine. There is a aperture in the cervical spine from which enter in the cervical spine and then reaches to the brain. Right common carotid artery and left common carotid artery divided at the level of C4 vertebra or upper level of thyroid cartilage in two parts. External part is the external carotid artery. External carotid artery and internally is the internal carotid artery. So right internal carotid artery and the left internal carotid artery goes up and forms the anterior circulation of the brain and supplies the brain. External carotid artery supplies is the our neck and the face and head areas outside the brain. So outside part is supplied by the external carotid artery, and inside brain supplies by the internal carotid artery, which forms the carotid system, right and left side of carotid artery. So now we discuss the vertebral system. So this is the both this is the midbrain, this is the pons, this is the medulla. This is our cerebellum. So two vertebral arteries, right vertebral artery and left vertebral artery, goes up and forms the combine and forms the basilar artery at the lower end of pons. At lower end of pons, both vertebral artery combine and forms the basilar artery. Basilar artery goes up, and at the level of upper pons or at the level of midbrain, it divided into two posterior cerebral artery, PCA. This is the posterior cerebral artery. This is the vertebral artery. This is basilar artery. So two vertebral arteries at the level of medullo-pontine medullary junction combine and forms the basilar artery. At the upper level of pons, midbrain and pons, both basilar artery divide into two posterior cerebral artery and supplies the brain structure. So this is the vertebro-basilar arterial system. So now branches of the vertebral artery. So one is the anterior cerebral artery, which is formed from the both side of vertebral artery. This is the anterior spinal artery, sorry, anterior spinal artery. There are only one single anterior spinal artery which forms from the vertebral arteries. So anterior spinal artery supplies the anterior two-third of spinal cord. Anterior two-third of spinal cord blood supply arises from the anterior spinal artery, which is the branch of vertebral artery. Then on bilaterally, posterior spinal artery arises. So second branch of vertebral artery is the posterior spinal artery, which supplies the posterior one-third of spinal cord. So posterior one-third of spinal cord supplied by the posterior spinal artery, which is the branch of vertebral artery, and anterior two-third of the spinal cord supplied by the anterior spinal artery, which is also the branch of vertebral artery. So for vertebral artery there are total 5 branches. One is the anterior spinal artery, posterior spinal artery. Other than this, it gives rise to medullary branches to the medulla, which is behind the vertebral arteries. Medullary branches, so third branches are the medullary branches. Fourth is the pica posterior inferior cerebellar artery, posterior inferior cerebellar artery, and fifth is the meningeal arteries. So vertebral artery gives rise to 5 main branches: anterior spinal artery, posterior spinal artery which goes to the spinal cord, medullary branches, posterior inferior cerebellar artery, and the meningeal branches, medullary branches, pica, anterospinal artery, and the posterior artery. Pica supplies the posterior inferior surface of the cerebellum. So posterior inferior cerebellar artery supplies the posterior inferior surface of the cerebellum. Spinal arteries, anterospinal artery supplies the 2/3 of the anterior spinal cord, posterior spinal artery supplies the posterior 1/3 of the spinal cord, medullary branches supplies the medulla, and meningeal branches supply the meninges. So this is the branches of the vertebral artery. After, at the level of pontomedullary junction, vertebral artery combine and forms the basilar artery. Basilar artery gives rise to branches, to the pontine branches, to the pons, pontine branches. One is the pontine branches to the pons. Second is the labyrinthine artery. Which supplies the internal ear labyrinth. Then this is the anterior inferior cerebellar artery, AICA, anterior inferior cerebellar artery. Fourth is the superior cerebellar artery, which supplies the superior surface of brain, and anterior inferior cerebellar artery supplies the anterior inferior surface of the cerebellum. So fourth branch of the basilar is the ICA, then SC, superior cerebellar artery, superior cerebellar artery, and terminal branches are the posterior cerebral artery, posterior cerebral artery. So branches of basilar artery are the pontine branches, labyrinthine artery, anterior inferior cerebellar artery, superior cerebellar artery, and then divide into the posterior cerebellar artery, which from anteriorly goes wrap around the midbrain and supply the structure of the midbrain and the thalamus and occipital cortex. So labyrinthine artery sometimes, many times arises from the ICA itself, not by the basilar artery. So these are the branches of the vertebral artery, and this is about the vertebral system. Once again, two vertebral artery forms the basilar artery at the level of pontomedullary junction, and at the level of midbrain pontine junction divided into the posterior cerebral artery. Branches of the vertebral artery are anterior spinal artery, posterior spinal artery, medullary branches, posterior inferior cerebellar artery supplies the posterior inferior surface of cerebellum, and the meningeal branches. Branches of the basilar artery are the pontine branches supplies the pons, labyrinthine artery supplies the internal ear labyrinthus, anterior inferior cerebellar artery supplies the cerebellum, superior cerebellar artery supplies the superior surface of the cerebellum, and posterior cerebellar artery are the terminal branches of the basilar artery. So this is all about the vertebro-basilar arterial system. Then the carotid system. So this is the internal carotid artery. Internal carotid artery enter into the skull through the carotid canal, and here it forms the S-like structure. Yes, this is called as carotid, or it enter in the brain through the foramen lacerum. So internal carotid artery, which is the branch of common carotid artery, enter in the brain through carotid canal, and it forms the S-shaped siphon and enter through the petrous temporal bone, and it enters in the brain through the foramen lacerum. After entering in the brain through foramen lacerum, it enters in the cavernous sinus. This is the cavernous sinus, this is the skull, and it gives the branches. In cavernous sinus upper part, it gives the branch ophthalmic artery, which crosses the superior orbital fissure and supplies the orbit, and it gives rise to supplies to the retina through the central retinal artery. So this is the ophthalmic artery. It gives rise to branch anterior choroidal artery, anterior cerebral artery ACA, posterior communicating artery, and the middle cerebral artery MCA, middle cerebral artery. Which supplies the brain. Anterior spinal artery goes anteriorly and supplies the brain. Middle cerebral artery supplies the lateral part of the brain. Posterior communicating artery combine with the posterior cerebral artery and make the circle of the Willis. So this is the posterior communicating artery, this is the anterior choroidal artery, anterior cerebral artery, middle cerebral artery, and ophthalmic artery. These are branches of the internal carotid artery. So ophthalmic, ACA, MCA, posterior communicating, anterior choroidal artery are the branches of the internal carotid artery, which is the branch of common carotid artery, and this forms the anterior circulation of the brain and supplies the maximum part of the brain. Ophthalmic artery enter in the orbit through the superior orbital fissure. Carotid artery enter in the brain through the foramen lacerum, and in carotid canal this forms the S-shaped structure. This is the carotid siphon. So this is the circle of Willis, which is the main structure that is supplies the brain. Circle of Willis basically combination of the anterior circulation of the brain and the posterior circulation of the brain. As we discussed, in posterior circulation there are two vertebral artery which combined forms the basilar artery. Basilar artery divided in the posterior cerebral artery. Anterior spinal artery are the branch of spinal artery, posterior spinal artery, posterior inferior cerebral artery. Meningeal branches and the medullary branches are the branches of vertebral artery. This is the basilar artery. Pontine branches, superior cerebellar, anterior inferior cerebellar, labyrinthine, and the posterior cerebral artery are the branches of basilar artery. So now we discuss the circle of Willis. This is the internal carotid artery, which gives anteriorly the ophthalmic artery, anterior cerebral artery. Both anterior cerebral artery combine through the anterior communicating artery. This is the anterior choroidal artery as we discussed. This is the posterior communicating artery which combine with the posterior cerebral artery and forms the circle of Willis. So circle of Willis have anterior communicating artery which is communication between the both anterior cerebral artery, this is the internal carotid artery, posterior communicating artery and the posterior cerebral artery. This forms the circle of the Willis. So this is the circle of Willis, supplies the anterior circulation and the posterior circulation, which is posterior communicating artery is the bridge between the anterior and the posterior circulation. If there is a compromise in the anterior circulation, sometimes posterior circulation will build up and give supply to the anterior part of the brain, and sometimes if there is a problem in the posterior circulation, through the posterior communicating artery, anterior circulation may help to supply the blood to the posterior circulation. So this is the very important point in the circle of the Willis. So as we discussed, this is the there are four parts of the internal carotid artery: cervical part, petrous part, cavernous part in the cavernous sinus, and the cerebral part. So this is the cervical part of the carotid artery. This is the petrous part of carotid artery, where they give the carotidotympanic artery, artery through the pterygoid canal. Then in the cavernous part, it gives the superior and inferior hypophyseal artery, which supplies the hypophysis cerebri and meningeal branches. After reaching the cerebral part, it gives the ophthalmic artery, posterior communicating artery, anterior choroidal artery, anterior cerebral and the middle cerebral artery. So if we discuss the cerebral part of internal carotid artery, gives rise to 5 branches. 5 branches: ophthalmic artery, anterior cerebral artery, middle cerebral artery, anterior choroidal artery and the posterior communicating artery. Vertebral artery also gives rise to 5 branches: anterior spinal artery, posterior spinal artery, pica, posterior inferior cerebellar artery, medullary branches and the meningeal branches. Basilar artery also gives rise to 5 artery, pontine branches: anterior inferior cerebellar artery, superior cerebellar artery, labyrinthine artery and the terminal branches, posterior cerebral artery. So this is all about the blood supply of the brain. This is the also same vertebral artery at the level of, this is the basically pontine area. Above pontine, this is divided into the posterior cerebral artery. This is basilar artery. This is the optic chiasma, because there is a circle of Willis is present around the optic chiasma. So this is the optic chiasma. This is the internal carotid artery. This is the anterior cerebral artery, which is combined through the anterior communicating artery. This is the middle cerebral artery. This is the posterior communicating artery, which combined with the posterior cerebral artery, and this is the our circle of the Willis. So now further, if we discuss the brain, so this is the outer surface of the brain. So outer surface of the brain, this is the upper part. This is the strip. This is supplied by the, and middle area supplied by the anterior cerebral artery. This is the area that have representation of the lower limb. So this area is the cortex, upper strip या parasagittal area supplied by the anterior spinal artery, anterior cerebral artery, sorry, ACA. So this is the our ACA artery, anterior cerebral artery, ACA territory. Main part, that is the middle part of the brain, this part is supplied by the middle cerebral artery, MCA. This part is supplied by the MCA, and this is inferior part of the temporal bone, temporal lobe, this part of temporal lobe, and the occipital lobe, this is supplied by the posterior cerebral artery. So anterior cerebral artery, middle cerebral artery and the posterior cerebral artery. If we see from the internal side cut section, then this part supplied by the middle part, above middle part, above the corpus callosum supplied by the anterior spine, anterior cerebral artery. Only small part of the this lobe supplied by the MCA artery, and posterior part is supplied by the posterior cerebral artery. If we see from the inferior surface, posterior part supplied by the posterior cerebral artery, middle strip, central side supplied by the ACA territory, and this area is supplied by the lateral temporal lobe supplied by the MCA territory, and posterior part supplied by the lower area of the occipital area supplied by the posterior cerebral artery. So this is all about the around the brain surfaces, how they are supplied by the various branches of the. Now the internal structure of the brain, like basal ganglia, internal capsule, supply some branches supplied by the MCA. Anterior choroidal artery also supplies some part of the globus pallidus, putamen, posterior limb of internal capsule. Some part supplied by the like head of caudate nucleus, mainly supplied by the ACA territory. Mainly head of caudate nucleus supplied by mainly the head of caudate supplied by the ACA territory. Internal capsule, major part supplied by the lenticulostriate branch of the MCA territory, but some part posterior limb of internal capsule supplied by the anterior choroidal artery, and some part also supplied by the anterior cerebral artery branch its branch recurrent artery of Hübner, which supplies the some part of the internal capsule. Thalamus usually supplied by the posterior cerebral artery. So basically these are the blood supply of the deeper structure of the brain. So they have multiple cells. Basically we discuss internal capsule, major part supplied by the MCA territory, caudate nucleus supplied by the ACA, and thalamus is supplied by the PCA territory. So this is also the same inferior surface. This is supplied by, this is the ACA territory, we supply the caudate nucleus nearby. This is the MCA territory, we supply the our caudate internal capsule part. This is thalamus, which is supplied by the posterior cerebral artery. This is also the deeper structure of the brain. So the thalamus is supplied mainly by the central branches of the posterior communicating and the posterior cerebral artery. So main supply of blood supply of the thalamus is from the posterior cerebral artery. The corpus stratum and the internal capsule is supplied by mainly the central branches of the medial and the lateral striate arteries, which is the branch of middle cerebral artery, and some extent from the anterior cerebral artery, as I discussed. Midbrain is mainly supplied by the PCA artery and some part by the superior cerebellar and the basilar. Main part supplied by the posterior cerebral and the superior cerebral. The pons is supplied by mainly the basilar artery, pontine branches, some part by the superior cerebellar and the anterior inferior cerebellar. The cerebellum supplied by the superior, anterior and the inferior, and the posterior inferior cerebral artery, like superior cerebral artery, anterior inferior cerebral artery, and the posterior inferior cerebral artery. So this is the all about the blood supply of the cerebellum. So till now we discuss about the two arterial system in the brain, anterior blood circulation and the posterior circulation. Anterior circulation forms by the two internal carotid artery, which gives rise to 5 main branches which supplies the brain and orbit: ophthalmic artery, anterior cerebral artery, middle cerebral artery, anterior choroidal artery, and the posterior communicating artery. Posterior communicating artery combined with the posterior cerebral artery forms the circle of Willis, which is an important structure in the brain for the coordination of the blood supply. Second is the vertebro-basilar system, which arises from the two vertebral artery, which combined forms the basilar artery at the pontomedullary junction. At the level of midbrain and the pontine, it gives rise to two cerebral arteries. So anterior circulation of the brain and posterior circulation of the brain supplies the whole brain stem, and circle of Willis forms by the anterior and posterior circulation through the posterior communicating artery. So this is all about the blood supply of the brain. In part 2, we will discuss about the clinical and the radiological correlation of the blood supply of the brain. Thank you. तो इसी तरह से मेरी वीडियो को लाइक करिए, वीडियो को शेयर करिए, चैनल को सब्सक्राइब करिए. थैंक यू.